Welcome to the Canadian Beef Cattle Podcast, presented by the Beef Cattle Research Council. The most popular content from beefresearch.ca, available on the go. Before we get into today's episode, a quick message from the BCRC. Have you calculated your herd's calving distribution? Calving distribution is the percentage of calves born in each 21-day cycle throughout the calving season. The benefits of having a shortened calving season include being able to market larger, more uniform calves, increase cow longevity, easier coordination of herd vaccinations, and easier comparison between calves. The BCRC's Value of Calving Distribution Calculator allows producers to see what their current calving distribution is and what the short-term economic benefit would be if they moved to a condensed breeding season of 3 cycles. Access the calculator by clicking the link in the show notes. The Beef and Forage Roundup podcast is a production of the Manitoba Beef and Forage Initiatives, created to share information with farmers, producers, and agriculture enthusiasts to showcase the important work that is happening at MBFI. This podcast digs deep into on-farm research and field testing practices related to beef cattle and forage production, as well as efficiency and sustainability of practice in the agriculture industry in Manitoba. Beef and Forage Roundup episodes drop on the first and third Wednesday of each month and are available wherever you listen to podcasts at www.mbfi.ca and on the Beef and Forage Roundup website. This episode is titled, Taking Pain Management Mainstream. Pain management for beef cattle has evolved significantly in the past 2 decades. Scientists have gained a greater understanding of what pain looks like in an animal and how reducing pain can affect an animal's well-being. The beef industry has also responded, with the advent of user-friendly, cost-effective pain medications, as well as veterinary teams and producers skilled at implementing effective pain mitigation. More veterinarians and producers are recognizing pain in cattle, and now we have a multitude of tools such as non-steroidal anti-inflammatory drugs like flunixin, ketoprofen, and meloxicam, and local anesthesia such as lidocaine blocks that we can use to better manage pain, explains Jennifer Pearson, DVM PhD. Pearson, a professor at the University of Calgary's Faculty of Veterinary Medicine, UCVM, studies cow-calf health and reproductive management, including pain mitigation. With new information about how to better manage pain in cattle, we can make appropriate management decisions to mitigate the health losses associated with pain, such as illness and loss of production, says Pearson. Pain management drugs like non-steroidal anti-inflammatories require a veterinary prescription. Today, more producers than ever are talking to their veterinarians to discuss pain relief options to help their herds withstand routine painful procedures like castration. As well, the use of pain medication is increasingly a part of a producer's toolbox for treating pain during relatively commonplace events such as calving or calf sickness. Pain in beef cattle is often thought in the context of tissue damage, such as castration, injury, lameness, or surgery, Pearson says. Inflammation from diseases like scours or pneumonia can also cause discomfort. Although calving is a natural process, it can be painful as well. Cows and calves that withstand a difficult delivery may benefit from pain management. Very few studies have looked at the implementation of pain medications in beef cows and calves after a difficult birth, says Pearson. Our research at the UCVM has shown that calves that receive meloxicam after a difficult calving gain more weight in the first week of life compared to calves that received a placebo, no medication, she explains. She adds that preliminary findings from a recent field trial also showed that calves receiving meloxicam after a difficult calving expressed more play behavior and were more active, compared to their counterparts that received the placebo. Currently, we are recommending pain medication to be given to cows and calves after a difficult calving, but more research is needed to better understand how this pain medication can mitigate other negative effects of pain in cows and calves, Pearson describes. Pearson says there haven't been any studies that investigate the economic benefit of using pain medication for difficult calving, but when speaking with producers, she finds that they are more than willing to reduce pain or suffering with a quick dose of pain drugs as an act of good stewardship. Cost of the medication doesn't appear to be a barrier to its use, Pearson observes. Garrett Wolf raises cattle with his wife Jacqueline near Spruce View, Alberta. On their farm, managing pain is simply a part of what they do when processing calves in the springtime or when treating a sick animal. We're not really doing anything crazy. It's become a practice that we do every year that makes sense for us, Wolf says. Our vet got a lot of people into it, he explains, adding that they started using it on a trial basis about 4 or 5 years ago and kept it up. It's just so dirt cheap compared to everything else. At Spring Processing, in addition to tagging and vaccinating his calves, Garrett surgically castrates his steer calves, giving them a dose of oral meloxicam to help manage pain. Anyone can administer it. It's less invasive than a needle, he says. If he has to treat calves for sickness, such as scours, Wolf consults with his veterinarian to determine if there's an opportunity to include pain management. Anytime we treat a calf, it's in pain of some kind, he explains. He finds the cost of the pain medication to be relatively affordable. The pain management isn't a miracle cure, but it's quite apparent it helps, he says. If it helps a little bit, it's worth it, especially for the price, Garrett concludes. Dr. Jacques Van Zyl, DVM, a beef veterinarian with Ontario-based Metzger Veterinary Services, says pain management is standard practice for him. Most clients are open to using non-steroidal anti-inflammatory drugs, he says, and adding a pain control product to a treatment protocol for diseases such as foot rot is manageable. Foot rot is painful, we do know that, he says. The only product labeled for managing pain due to foot rot is pour-on Banamine. Anything pour-on needs to be absorbed through the skin, Van Zyl explains, noting that there is room for error with administration. It needs to be applied to the skin, not just poured on top of the hair. Improper application is a common issue for failure to respond to treatment, he says. Van Zyl acknowledges that pour-on products, particularly in pasture situations, may not be practical for producers to apply. He recommends producers contact their vets for other available pain control options that might be feasible. He points out lameness can have several causes, and getting an early and accurate diagnosis is key. Veterinarians should lift the foot and inspect the area for swelling, redness, and other signs of infection to rule out injury or a foreign object embedded in the foot that could otherwise cause pain. You have to be sharp on the follow-up and look at treatment success rates, he says, noting that bacteria causing foot rot typically responds to antibiotics very quickly. Van Zyl says that there has been an increase in combination drugs that work to manage both pain and infection. I think that might indicate a change in the market. Guys want to give something for a reduction of fever, but don't want to give 2 needles. So there are more options available that are a one-shot deal, he explains. Getting more products on label for pain management is the biggest thing, Van Zyl says. Experienced Alberta feedlot operator Leighton Kolk has seen a transition in the approach toward cattle care that includes a willingness to incorporate pain management. Leighton, who is the CEO of Kolk Farms, based out of Iron Springs, Alberta, has seen the industry prioritize stress reduction and pain management in beef cattle. I guess it's twofold, he explains. One is recognizing the importance of pain management, and the second is then actually having something that we can use, Kolk says. Having the philosophy that managing pain is worthwhile goes hand in hand with producers gaining access to user-friendly products. It's nice to have a $6 per head treatment, and we know it works, Kolk says. His pain control go-to is oral meloxicam. It's very economical and easy to use and works really well. We use that for everything, Kolk explains, but adds that meloxicam has a 35-day pre-slaughter withdrawal period, so he has a few other options if animals are getting close to their harvest date. Injectable Medicam works well too and has a 20-day withdrawal, he explains. Anafin is another pain drug that has a much narrower 1-day withdrawal window. As prey animals, cattle tend to hide the fact that they are in pain, so the Kolks don't wait for an animal to show signs of discomfort before they administer pain medicine. We don't like to display pain if we don't have to, and neither do cattle, he says. They use pain drugs for castration, prolapses, and just about any condition that might potentially cause a feedlot animal pain. For lameness, they will also use pain control strategies, but first diagnose the underlying cause. We will use it usually in conjunction in picking up a foot or looking for that injury or rock stuck in their hoof or a toe abscess, he explains. Managing pain is important for staff morale as well. One thing about our staff is they do the job because they care about the animal, and when they see an animal that is comfortable, they feel better about their job, Leighton says. I feel better and can hold my head up proud, knowing that I'm not causing distress, and the side benefit is the cattle perform better, he explains. So often in livestock agriculture, doing the right thing seems to be almost always be the right thing economically. The big win I see is with animal comfort, he concludes. While pain management is still advancing, producers, scientists, veterinarians, and pharmaceutical companies are working together to develop practical, effective pain management solutions. Thank you for listening to this week's episode. You can find all relevant links and information at beefresearch.ca or in the show notes. The Beef Cattle Research Council is funded by the Canadian Beef Cattle Checkoff and strives for excellence in the production of Canadian beef, cattle, and forage through research, innovation, and extension. Tune in every Tuesday as the Canadian Beef Cattle Podcast delivers straightforward insights, expert information, and a wealth of practical knowledge for Canadian beef producers. Subscribe now.